Skeletal system. What are some of the functions of the skeletal system? So some of them might come to mind to you right away. I'm going to have you, I'll talk you through a little bit, then you can pause and see what you can come up with, and then we'll go through the notes and you can see if you were right. So my first hint would be, what would your body be like without bones? What are the things you wouldn't be able to do anymore? And think about some of your soft tissues like your brain and your heart. What do you think your skeletal system does for those? Another one that might not be quite so obvious, maybe you know someone who's had leukemia, or you've heard of that. That's a cancer of the white blood cells. And when that happens, I'm absolutely not an expert here, but when that happens, I think you have chemotherapy to kill off all of your bone marrow, and then you get a bone marrow transplant. So think about what bone marrow's function is based on that. And then another one, what are bones made out of that makes them so hard? So now you can pause and think about what you think the functions of the skeletal system are, and then come back on and we'll go over them. Okay, so hopefully you've had a few minutes to think about it now at this point. Functions of bones. The first function that I want to go over is support. So bones form the framework that supports the body and cradles the soft organs. So without your bones, you would be a jellyfish or a worm. Well, maybe not quite, but they give you support so that you have a structure or a framework for your body. The next thing, if you thought about the soft tissues in your body, like your brain or your lungs or your heart, your bones provide protection. So here's this protective case for your brain. There's also your vertebral column that protects your spinal cord. And then some of your vital organs like your heart and your lungs are protected in your ribs. And some of your internal reproductive organs and the lower part of your intestines are protected at least partially in your pelvis. The next thing is movement. And so here's a person, maybe they're dancing, and you can see the bones helping you to move. So movement is the next function, and the thing that the bones themselves aren't the thing that causes the movement, but they provide levers for muscles. So here's your arm bones, and this is it's called the origin of the muscle. It's where the muscle is stuck onto the bone and it doesn't move. But when this muscle contracts, it shortens, and when it shortens, it pulls this part. So the muscle is attached to this bone and to this bone. This one is stationary, it stays right where it is, and this one moves when the whole muscle contracts. So the muscle contracts and this one moves. So that's a type of lever. The next one maybe wouldn't be quite so obvious unless you thought about it for a little bit. And so the next one is mineral storage. So you might think, and by minerals we're mainly talking about calcium. So your bones actually serve as a reservoir or a holding place for minerals, especially calcium and phosphorus. So let's talk through that a little bit. You need calcium in order to do, in order for your nerves to work. And you need calcium in order for your muscles to work. So your nerves have calcium that comes in, and it allows the neurotransmitters to leave. And your muscles need calcium in order to make them actually start to contract. It allows, we talked a little bit about actin and myosin, I think, before. It allows those two to come together. You also need it for your blood to clot. And so you need calcium for all these things. So you keep blood in your, you keep calcium in your blood at all times. So you can have it for your nerves, for your muscles, and for your clotting. When your blood calcium gets too low, you take it right out of your bones, right into your blood. And so what happens is that if that happens too much, instead of your bones being nice and strong like this, they end up looking like this. And so there are some little holes, little spaces inside your bones naturally, but most of this bone tissue, this is pretty dense bone tissue. There's lots and lots of calcium, lots of collagen, lots of bone itself. This is someone who has osteoporosis, and this is what their bones look like. And so you can see the holes are much, much bigger, and the bone tissue itself is much, much thinner. And so if you are at risk for osteoporosis, then when you're young, like most of you listening to this are right now, you need to make your bones as dense as possible. So the way that you make your bones dense is to take in plenty of calcium. And the way you take in calcium is either you drink milk or you eat a lot of green leafy vegetables, or especially the dark green ones, or you take calcium pills, which is what I do. And then another thing that you can do to make your bones strong is weight-bearing exercises. So is that right, David, with a Z?
Um, I think it's an S.
Is that an S? I don't know how to spell.
Oh, well, exercise. Oh, I thought you were talking
I
about
think
at the
it's a
very
Z.
end of the sentence.
Oh, yeah, that's an S. Um, so anyway, weight-bearing exercises will make your bones stronger because they'll get thicker. And the more bone you can lay down now while you're young, the better. Because eventually, especially for the women, when your calcium levels go down at menopause, that's a time where you lose lots and lots of bone tissue. So if you can start at a higher level of bone tissue than when your calcium levels decrease, they'll only decrease to maybe an acceptable level. Whereas if you start off with less bone tissue, then the concern is that your bone tissue, when you're done with menopause, will be much, much too low and you'll end up with osteoporosis. So people at risk for osteoporosis are women a little bit more than men, maybe a lot more than men. White women or Asian women are more at risk. I think if you smoke, that's another risk factor. If you've had anorexia or an eating disorder, that's another risk factor.
If you smoke, everything gets messed up practically.
True. Okay, here's the last one. And so this is more of the stuff that's inside your bones, but it's still considered the skeletal system. And so this stuff is called bone marrow. Bone marrow is either
Isn't that the stuff that makes red blood cells?
very good. And so one thing that kids will say all the time is that this red stuff makes red blood cells. I don't know why that just happened. But it also makes white blood cells, and it also makes platelets.
It makes everything in the blood then?
It makes all the cells that are in the blood.
Not the
Plasma.
yeah, not the that's what
Yeah. So these things make the blood cells, and the reason that they're red is because you have way, way, way more red blood cells made than white blood cells or platelets. And so, excuse me. So blood cell formation, red blood cells, white blood cells, and platelets are made in the red bone marrow. And so the way you can remember that is if someone does have leukemia, which is a cancer of the white blood cells, they'll have their bone marrow destroyed by chemotherapy, and then you'll have an injection of someone else's bone marrow. Hopefully that matches. And so then
they don't know the matching.
Well, they'll definitely have to match them ahead of time.
Maybe I just thought it was kind of something like back in time when they didn't know the cell type.
I don't. I think they've only been doing this since they've been aware of how to do it. So anyway, you have to match them for the antigens that are on the surface, which hopefully we've talked about by the time you see this video. So you're putting in somebody else's bone marrow, and so that makes the blood cells. And so hopefully the example of leukemia will help you remember that blood cells are made in the bone marrow. And so in a baby, you have red bone marrow pretty much within every bone. By the time you're an adult, it's really in the more central ones. So
it's in
your sternum, your vertebrae, I think your skull. No, maybe not your skull. I should look that up before I do this, shouldn't I? So definitely your hip bones, your vertebrae. I think your sternum is another one. I think even the ribs. Am I right? I think even the ribs. I think the top of your femur as well. In the clavicles, I think bone marrow is in your clavicles too. I think the skull, yes, but I'm not. You know what? I have to double check on that one. Okay, next thing, structure of a bone. You know what? We've been doing this for 9 minutes. I think I will make a different video for that one. Bye. Say goodbye, David.
Bye.